Hello. Hey. Okay, let's make a start on this afternoon's session. And kicking us off, we have Jamie, Elisa and Neil from the South East Data and Analytics team. So over to you guys.
Sorry, I've missed Elisa as well. She's part of our team. Afternoon, everyone. Welcome to our presentation. So we're from the Data Analytics team for the South East region, NHS England. And today we're talking about redesigning the mental health integrated performance report within the South East. So the agenda, there's three broad kind of themes we're going to be looking at. Stakeholder engagement, automation and standardisation, and improvements to analytical outputs. Obviously there'll be a conclusion and then 5 minutes Q&A at the end if you've got any questions. So starting off, what is the mental health, learning disabilities and autism integrated performance report? So it's used for a variety of meetings within the region. It's taking data from a number of sources, for example, the mental health services data set, the COVID sit rep, which looks at things like bed occupancy, that kind of thing. Assuring transformation and manual data collections, which are taking place within the region from providers. It helps support discussions around capacity and meeting targets. And it's very much kind of like a pathway approach, so from talking therapists, community to inpatients. Also monitors progress against the operational and long-term plans and identifies providers or ICBs of concern. Pass you on to Elisa for stakeholder engagement.
Hi, so for the stakeholder engagement, first we had some internal meetings between the data and analytics team and the mental health team. That was following a survey we had with ICBs and providers to understand how the IPR report was used, if it was useful, and what opportunities for improvement there were. So after the survey, we saw that the report was too busy, had too many metrics. There were duplication of the metrics just presented in different sections in different ways, so it was quite confusing. So, so in this meeting, the purpose was to reduce the burden on systems, to simplify and standardize the data. As part of the process, we also wanted to change the process of how we collected the manual data for the demand and capacity reports. So for this purpose, we formed a task force group together with ICBs and providers. So I can show you here how the process was before. It was quite messy. So each provider was sending their own internal reports, which had all kind of metrics. So not only the metrics we were asking for, but also their own metrics. There were no clarity on the definitions of the metrics we were asking, so there were a lot of data quality issues. There were different formats in Word, PDF, Excel. So to improve this, we, together with the ICBs, we ensured that they took ownership of the returns of their providers, and for them to use only just one format. And also we worked together with the Regional Operations Center for them to follow up on the returns and make sure that all the data is completed correctly according to the definitions. So the improvements we have was reduction on the data quality issues. We developed other metrics that we were not collecting before that were more useful, more clarity, and less burden on our systems. So now the fun part with Neil, if this works.
Thanks, Elisa. So I'm going to talk a bit now about the process of automating report production. Our old process was very, very manual. Previously, we used to have to enter data directly into an Excel template, which then produced the charts we needed, and then physically copy and paste those into our PowerPoint presentation. Obviously, a lot of drawbacks, as you can imagine, with a process like that. Very inefficient in terms of time and labour. Lots of scope for human error. You could type in, you could mistype the data. You could paste the wrong chart in the wrong place. All sorts of things that could go wrong. Also, a lot of the data was taken from a dashboard that was produced by another team within the organisation, and we had no control over, which often meant the data wasn't actually timely. Difficult to get the formatting right using Excel, and also difficult tasks such as data wrangling, very difficult to automate in Excel. So our new process, much more automated. For a start, where at all possible, the data is pulled directly from a data warehouse using a SQL script. The charts are created using some R script, including such packages as the NHS Plot the Dots package, which produces statistical process control charts, among other things. ggplot2 is also used. At this point, I'd quite like to give a shout out to my colleague Tom, who did actually most of the original work on the R code, because his R skills are far in advance of any of ours. So what we're doing is basically based on his work. The chart formats are held in an Excel sheet. They're not hard-coded in R. So things like the minimum and maximum values for the axes, the point sizes for the lines of the charts, that sort of thing, all held in Excel. So if we need to change them, we don't need to amend the R code. And many of our charts, and we're working towards hopefully eventually this being all of them, but many of our charts are now written directly into the final presentation, rather than just being spewed out by R into a separate file and then copied into the final presentation. So there's even less human intervention. So some of the benefits of this: obviously it saves time. We've automated over 70 charts so far. The data is more timely because it's pulled directly from the data warehouse rather than going from some other person's dashboard. All the formatting is taken care of by the R code. So once that's all set up, you don't need to think about formatting again. It's all done. And obviously it removes some of the potential for human error. As a team, as I mentioned, we didn't have great R skills to begin with, so this has been a great opportunity for development. And the other thing is that is consistent with the RAP principles, reproducible analytical pipeline principles. For instance, or some of the principles anyway, for instance, automation. Clearly it's a fairly automated process. Use of open source tools, well, R certainly ticks that box. That's an open source tool. And transparency, so that people can see, you can see what's actually happening, what the code is doing, and version control are taken care of by using GitHub. And I'm going to hand back to Jamie.
So, as a result of all these kind of changes, we hope that, well, we're pretty confident that we've improved the outputs of the kind of analysis. So you can see on the left-hand side some of the charts and narrative from the old report. So there's like a lovely trend line going down on that bottom left chart. So, things like that we wanted to change. A lot of, like Elisa said, a lot of metrics were duplicated, so we're reporting things like one metric 4 times. Some of the charts were very inconsistent, a bit difficult to read. A lot of them had different time periods, like some were looking at weekly, daily, for longer periods and shorter periods. And a lot of the narrative was like looking at kind of current performance versus the previous week, so like 2-point comparison, that kind of thing. So, interest of time, just move things along a little bit. So the charts to the right-hand side are kind of what we've ended up with. So you can see, we hope that the visuals look a bit better, a lot clearer. We're using, SPC charts, for example, box plots, a variety of different charts, and these are produced in vast majority in R. And also a lot of the narrative is shortened, and it's based on like exception reporting, so special cause variation, that kind of thing, rather than just narrative about things that are just normal variation, for example. So, come to conclusion. It's very very quick. We've talked very fast, but a lot to fit in within 10 minutes. But just hope that you get 3 takeaways from this presentation. And they're nothing new, they're quite obvious, to be honest. Stakeholder involvement was really important. We had a good team of people working with us, from the mental health teams, and a lot of leadership from them, and they work very closely with us. Developing skills, like Neil said, has taken us time. We're still learning. There's loads for us to learn, but if you invest the time, you'll get it back. And you know, continue to review the analytical outputs, and is it answering the question over time. So that's it. Thank you. Quick one. That's our GitHub repo, if you want it, the QR code for that, and then also our Southeast Data and Analytics Futures site code. Thank you.
Thank you very much, and also congratulations on timing that to perfection. We do have some questions coming in on Slido. If anyone wants to put in a question on Slido, the code on slido.com is 3716942. Equally, I am going to go old school and do a bit of a roving mic around the room, so you can just stick your hand up in a minute if you want. We've got 5 minutes. Questions in Slido. From Peter, does your SQL data pull come from Trust Data Warehouse or from national sources?
Yeah. So it comes from an internal database of NHS England called NCDR, which stands for the National
Commissioning Data
Repository. Thank you.
Fab. I'm going to use Chair's prerogative and ask a question, which is, do you have an estimate of how much time you've saved?
I don't know. What's
Probably, I would say at least half a day. Probably about half a day a week, I would think. Maybe slightly more than that. Maybe even a day. Yeah.
That's amazing. That's really good.
A long time, so. Yeah, hopefully quicker as well. We've got a few things lined up.
And you flashed up a few things here, but I did also wonder if there were particular communities that you kind of went to help, get help from, advice from, learn from, and any that you particularly like to sort of shout out.
Well, on the previous slide, I think I whizzed past it, but since Simon's here, we've got things like the coffee and code that Simon's involved with, which, you know, is really good for sharing, developing our skills, that kind of thing. So that's something that we go to. This is like kind of the matrix meetings that we're involved with for our analytical group for mental health. So it's around sharing code, that kind of thing. But I'd say we've got within our teams, there's a lot of support and help with these kind of things. Like Tom got to mention earlier, who, you know, has kind of helped us as well with this. So yeah.
The coffee and code thing, is that something that other people can access externally?
Let's Simon.
Yeah, if you go onto the MHSR community, there's an offer for, it's every 2 weeks, there's a coffee and code session for, it's just an open season that people come along, do show and tells, or if there's sort of questions, and anything is available, so yeah.
Wonderful, sorry to put you on the spot and use your croaky voice. Any questions from the floor? If not, I think we do have another one from Slido. From Tom. How has it been introducing statistical process control charts to stakeholders? Were they hesitant? Did they understand the importance?
Can't believe you asked that one, Tom. So yeah, I mean, I think at first it was quite a challenge, actually. I think just because it's something new. Often we get the response back from certain staff groups that, like, I don't do data, for example, they might struggle with understanding things. But I think once you kind of reiterating the same message over and over again and providing examples, it kind of seems to sink in a bit more, the kind of messages. And also, like we tend to, like I said before, we use the SPC charts, for example, to inform our narrative. So in a way, they don't always have to understand the kind of technical things beyond this SPC charts, for example. It's within the narrative. So yeah, it's been a bit of a challenge. Some are taking to it more than others, but certainly, you know, all our charts now are more or less in the SPC charts. So yeah.
Thank you very much. Any final questions?
My name's Nikki and I'm from the local ICB. I've been trying to build my own mental health and LDA dashboard, and you mentioned that most things are measured in SPC. One of the issues I have is that there's so much mental health data that's either only published quarterly or is a rolling 12 months. And on a rolling 12 months, there's no way of plotting it on an SPC chart because that would be meaningless. How do you handle that sort of thing?
Yeah, we've been looking at that recently, actually, like looking at the operational planning metrics for this year, and yeah, a lot of them, like you say, they're like a 12-month rolling period. So we've looked at more kind of the variance to plan for those, but the ones that we can, like dementia diagnosis one, for example, the ones that we can, we do use SPC icons for that within like the tables and stuff. So yeah, it's a bit of a challenge. We do get quite a bit of kind of manual data from providers as well, which we use using SPC. But yeah, there's a lot of stuff that's out of date, isn't there, in a quarterly basis or rolling periods. So, yeah.
Okay, I think that brings us to the end of this presentation. So one final thank you to the team from the South East.